Hello all, myself Murshida Yasmin, Assistant Professor from SNS College of Physiotherapy. In this video, I'm going to talk about osteology of the tibia in the subject anatomy. As you all know, osteology is the study of bone and its structures. So this video is going to help you by understanding what are the parts which are present in the tibia and where it is located, and we can explore the osteology of the tibia in a better way. As you all know, tibia is a lower limb bone which is located near to the fibula, which is a similar bone related to the upper limb called the radius. And this tibia is giving a major contribution to form the biggest joint in our human body called the knee joint. So let's define it, how to study the structure of the tibia. Tibia is the medial and larger bone of the leg. It's not located in the thigh. Thigh is completely related to femur bone, and below to the thigh is the leg compartment. So, in that, a medial and a larger bone is called the tibia. It is a weight bearing bone in the human body. It is also called as shin bone. So, likewise, here it's the tibia bone. This is how the tibia bone looks like. And this is the picture showing you a right tibia and the fibula. So this is the anterior view and the posterior view. Let me explain about you the parts of the osteology of the tibia. So this bone is the tibia bone and located near to the fibula, which is a thin bone. So here the tibia is having an upper end and a shaft and the lower end. Similarly, the posterior view also having an upper end, shaft and the lower end. So the upper end has a articular surface which has a medial articular surface and lateral articular surface. Medial articular surface articulates with the medial condyle of the femur. Lateral articular surface articulates with the lateral condyle of the femur. So the front structure which is roughly present is called as a tibial tuberosity. And there is a crust present over the anterior surface, that is the anterior crust. And the lower end having a specialized structure called a medial malleolus. So this malleolus together with the lateral malleolus of the fibula is giving a good space and a good joint for the ankle joint. And this tibia bone is connected to the fibula bone by a membrane called interosseous membrane, which is grayer in color here. So this interosseous membrane gives a good contact between the tibia and the fibula. And the posterior surface, you can see this tibia bone. Similarly, here you have a medial malleolus, and below to the medial malleolus is articular surface. Here the talus bone will come and articulate. So how to empathize this? What is the need to study? Where is the need to study the tibia bone? In case of tibial fractures, which cause severe pain in the shin compartment, and the difficulty of walking will be present in case of tibial fractures. So the tibia fractures are most common in road traffic accidents, and also in some vigorous sports injuries also happen. So in case of fracture, so inside the bone, here is the inner structures which are present, the articular cartilage. The upper end is having a spongy bone, and the center or the shaft is having a compact bone, medullary cavity, endosteum, and the periosteum, which is the outer layer of the bone. So this layering of the bone will break in case of the road traffic accidents, which causes the fractures. So as I told, the upper end and the middle end and the lower end, the other name of it is, the upper end is called as epiphysis and the middle is diaphysis. The lower end is also called as epiphysis. Ideate. How can we ideate this tibia bone? Yes, it acts as a main support for the body weight, and it transfers weight from femur, thigh bone to foot. Yes, it is acting as a bridge between the thigh and the foot, and strong and essential for standing and walking. Upper end. So upper end is having a medial condyle, lateral condyle, and the intercondylar area. The anterior intercondylar area, posterior intercondylar area. Here is a medial condyle and the lateral condyle. There is a tubercle present in front of the lateral condyle as a Gerdy's tubercle, and there is a oblique line present from lateral tubercle, and there is a tibial tuberosity present over here. And the intercondylar eminence is present in the upper end. These are the structures which are present in the upper end of the tibia. Shaft, it is a triangular in shape, somewhat triangular in shape, not exactly the triangular in shape. And it has three borders. Here, this is the shaft anterior border and the medial border, the lateral border, and three surfaces: medial surface, lateral surface, and posteriorly there will be posterior surface. Interosseous border. Interosseous border is a border which is having connectivity with the interosseous membrane. So this is the shaft and its structure. Lower end, as I told before, lower end is having a malleolus, which is a sharp projection like structure, and that is a medial malleolus. And there is a notch present here to accommodate the fibula, that is fibular notch, and there is a surface present over here that articulates with the talus. To summarize about what I have discussed about the tibia in this video, we'll start from here. Tibia is a shin bone, medial bone, weight-bearing bone of the leg. So tibia has a proximal end, superior, distal end, which is present inferior, shaft, which is a diaphysis, and the intercondylar eminence, that is eminence that present between two condyles, and the medial weight-bearing bone of the leg again. So let's see, proximal end is having medial and lateral condyle, and the tibial plateau and the tibial tuberosity, which is giving an attachment for the patellar ligament attachment, otherwise called as quadriceps ligament also. And the distal end is having a medial malleolus, form the medial stability of ankle joint, inferior articular surface forms the ankle joint, fibular nut, lateral side facet, distal tibiofibular joint. And the shaft is having a triangular cross section, anterior, a lateral, medial, lateral. So this type of triangular in cross section, the shaft will be looks like a triangle. And the bone is having a shin crest, that is subcutaneous crest. You can feel a sharp bone-like structure on the anterior compartment of the leg. That is a subcutaneous crest. We can easily feel it under the skin. And soleal line is present, which is a posterior oblique ridge for the muscle attachment of the soleus. So that's all about the tibia bone. Tibia is an important bone in our weight bearing of daily day-to-day activities, and it is a major medial bone which is present in the leg. So hope you all have understood clearly about the basics of the tibia parts and the upper end, lower end, shaft, and what are the structures present over there. So I'll see you in some other video with some other good information related to anatomy. Thank you.